Hey everybody, it's Paula here from Ohana Therapeutic Massage. Somehow I completely spaced on last Thursday and coming on for our Technique Thursday, so I'm kind of a week behind. So, which is okay, life happens. So I wanted to come on, just talk a little bit about Myofascial Release, who kind of benefits from it, and then go from there. And then next week, when we do our Thursday, our Technique Thursday, we're gonna do specific conditions or specific areas that we treat and how we address them, to kind of give you a really good base knowledge on what goes on. So, but right now, we're just going to talk a little bit about Myofascial Release. I do the John Barnes approach to Myofascial Release, and I very much state that for the plain and simple fact that there's a whole spectrum of Myofascial Release. It's not just one technique or another. So even if you've had Myofascial Release or MFR, like I like to call it for short, other places, what I do might not be the exact same thing. Not only that, but each MFR therapist or each massage therapist has their own spin and their own personality. And so you can see 100 people who do the same technique and you're going to get 100 different treatments because they have a different life experiences, they have different skill set, they have different levels of education, and they just have a different personality. And so every session is going to be a little bit different. And with the John Barnes method, we don't walk into a treatment room with a treatment protocol. And so every single session is different anyway, which makes my job super fun. It's not a word that people use very often, but I get really excited on finding all the little different ways that the body's connected. And so Myofascial Release, the John Barnes approach, uses gentle sustained pressure to sink into the tissues to allow the body to self-correct and heal itself instead of trying to force our way in and bully the body into healing. And so that's one of the biggest things that's different. Gentle sustained pressure doesn't mean it's always super light. Sometimes your fascial barriers are at different depths, day to day, different person. And so where I'm able to sink into the different fascial barrier one session, the next session I might not be able to sink in as deep, or the next session I may be able to sink deeper. And so it really just kind of depends on where your body is at that time of session, on how your body, what kind of pressure and depth and intensity that the Myofascial Release session will be. And then the other thing that makes it different than most traditional type of therapies is we hang out for an extremely long period of time, and that allows the body to not only relax superficially, but all those deep layers are able to soften and relax by hanging out in one release for a long time. And I mean like 3 to 5 minutes long time, sometimes 10 minutes depending on if there's a lot of stuff going on in there. But like I said, it's kind of layers of an onion. You have our bodies are so complex, and like we don't see that much difference, like how thick stuff is, but there is layer upon layer upon layer upon layer of fascia and connective tissue. And if I just kind of sink in for 30 seconds, I'm getting about that much when I could be sinking in that much. And so that's why we hang out for a really long time, is to really get a deep release instead of a superficial release. And so that's just kind of a brief synopsis of what Myofascial Release is. It's not organized like a traditional therapy session, and so you actually wear like a 2-piece swimsuit, tank top, shorts, something like that, so that I have the most skin access while still respecting your modesty. And then conditions it helps with. So I have experienced in my own personal practice over the years, I have helped people with fibromyalgia reduce their symptoms. We cannot cure anything, but we're just reducing the symptoms. Fibromyalgia, chronic fatigue syndrome, repetitive stress injuries. I've helped a couple people avoid surgeries because the issue was able to be resolved without surgical intervention. That can't always be the case, but it does help sometimes. I've helped babies, actually. I had the privilege, absolute honor to work with a baby at the end of last year who was having breastfeeding issues, and we actually were able to reduce the fascial restrictions in the baby's cranium, and the baby was allowed to breastfeed naturally, which is super exciting and really fulfilling, actually. I've helped women who are getting ready to deliver soften the pelvic floor area so that they can have a more natural, easier birthing process. Yeah, so limited range of motion, chronic pain problems are huge with it. Basically, if you have fascia, I can probably help you, because like with Vanessa and craniosacral, everybody has a central nervous system, everybody can benefit from it. Same with Myofascial Release, everybody has fascia in their body, and so by slowly sinking into it, we can kind of help a whole variety of things, just a huge wide gambit. Chronic pain problems are huge with it. Basically, if you have fascia, I can probably help you, because like with Vanessa and craniosacral, everybody has a central nervous system, everybody can benefit from it. Same with Myofascial Release, everybody has fascia in their body, and so by slowly sinking into it, we can kind of help a whole variety of things, just a huge wide gambit. But those were kind of the highlights of it. And so if you have any questions about any particular cases or anything like that, you can put them in the comments below. I've kind of specialized so far in people with chronic pain syndromes or severe limited range of motion, chronic issues that haven't been resolved by other things. But really anybody can benefit from it. And I've been super excited to be able to work with a lot more children these days on reducing anxiety and depressive, like not actually curing anxiety or depression, but reducing those effects and some of those stressors that are happening in kids' bodies. I've worked with kids with autism and helping them become more connected with their body so that they don't have as many behaviors. And so it's been really fun to kind of see all the different kinds of populations that I can help with this type of work, because it's not like a traditional massage in any way. So, which makes it fun because then every session is different. Anyway, I already said that. So, like I said, if you have any comments, put them in the questions, comments, concerns, put them in the link below. Otherwise, I have a Myofascial Release page, like a group just for Myofascial Release. I'm going to start being more active in that in the coming weeks here, where I'm going to kind of come on, explain the therapy a little bit more in detail, but give you self-care recommendations as well, because there's only so much we can do an hour at a time, and a lot of it really does lie on you taking control and taking care of yourself so that we can help you more effectively. So there was our Technique Thursday, and I hope you guys have a very, very safe and wonderful day with this wonderful winter wonderland we have out there. Thank you guys. Bye.